Welcome back to Fixing Healthcare in America podcast with Paul Carroll. Today we're going to talk a little bit about a new area to save money in a health plan. It's called direct primary care. What if I told you that your employees could have access to care where they could have same or next day appointments, and the cost of those appointments would be zero for them, and it would lower the cost to the employer group plan by up to 25%. What is direct primary care? Direct primary care is a way that we use our self-funded plans. They're able to make contracts with local physicians, and they can have it set up so that the employees can visit the physicians anytime, either virtually or in office, and they have their own actual direct primary care doctor. Every employee has access to care with a $0 copayment, and this saves the company on the claims. Within direct primary care, there is no need to use your insurance program. There's no out-of-pocket cost for the employee. Everything is based on a direct contract between our self-funded plan and individual doctors locally. What is direct primary care and why is it important? Direct primary care is primary care to keep your employees healthy. If all of your employees have access to same day or next day appointments, it keeps them out of the emergency room, it keeps them out of the urgent care, as well as it keeps their annual physical and wellness at a higher level. Higher level employees that are healthy have less care in the emergency room, thus saving money. In our direct primary care model, the employer plan pays the doctors directly and they pay a flat monthly fee. Sometimes this fee is $25 up to $75, depending on the contract and the amount of patients that we have that are going through this direct primary care plan. However, the access to care and the time to get an appointment is usually within 24 to 48 hours. The employees really like this model because they like having access to care, and sometimes they even access care virtually. I'd like to give you some statistics about a local group that we have. They have 150 employees and they have a direct primary care program. In an 8-month period, they had 895 doctor visits. Those 895 doctor visits saved over $135,000 because the employees stayed out of the urgent care, they stayed out of the emergency room, and they were also happier about the access to care that they had. Inside of a direct primary care plan, you ask, how can you save that much money? The reason that there's a lot of savings is if you can avoid 1 or 2 emergency room visits. Emergency room visits cost about $25,000 per visit, and if those claims are actually avoided, that's a savings to the plan. Urgent care visits run about $1,000 per visit. If you can avoid urgent care visits, you've saved $1,000 per visit. So if you could save on 2 or 3 emergency room visits or 6 or 8 urgent care visits, the savings adds up substantially. And employees are happier to have access to quality care in a short amount of time. Direct primary care is one of the many levers that we use in our self-funded clients. A lot of employers are wondering, why aren't we doing this? Well, the question is, why not? If you can have access to a direct primary care visit and your employees are happier and have quicker access to care, why not try it? It's easy. We have a dozen physicians that are ready to treat your employees. In closing, if you'd like to learn more about direct primary care or any of the other 10 cost solutions that we have to lower the cost of care, please feel free to reach out to me.